Okay, let's talk about complement.
The complement system is a set of proteins that circulate in the blood serum. When activated, these proteins work together to destroy foreign cells by cytolysis, to activate the inflammatory response, and to assist in phagocytosis. The main components of the complement system are called C1 through C9.
See, all that's happening. A bunch of stuff is happening. To be like, that is not a self cell. Okay. Let's talk about activation.
Complement can be activated through 3 different pathways: the classical pathway, the alternative pathway, and the lectin pathway. The classical pathway was the first activation pathway of the complement system to be discovered. The classical pathway begins when a pair of antibodies attach to antigens, such as proteins, or a large polysaccharide on the surface of a bacterium. The antibodies bind and activate C1. C1 then cleaves several copies of C2 and C4. Together, the C2A and C4B fragments form an enzyme that cleaves C3, activating the complement system. The alternative pathway of complement activation was so named because it was discovered after the classical pathway. While the classical pathway requires antibodies specific to the invading microorganism, the alternative pathway requires 3 complement proteins called factor B, factor D, and factor P, or propertin. These proteins are attracted to microbial cell surface material. The most recently discovered pathway of complement activation is the lectin pathway. When macrophages ingest material through phagocytosis, they release chemicals that stimulate the production of carbohydrate-binding proteins called lectins. The lectins bind to distinctive patterns of carbohydrates on the surfaces of certain bacteria and viruses.
And that starts complement. Okay? Finally, what are the results?
Once the complement cascade is activated, several events occur that ultimately result in the destruction of the pathogen.
That's what we care about. Destruction of the pathogen.
C3A and C5A act as chemotactic factors, attracting phagocytes to the site of infection. C3A and C5A also bind to mast cells, triggering the release of histamine and other chemicals as part of inflammation. C3b acts as an opsonin, coating the invading cell. This coat makes it easier for the phagocyte to adhere to the invading cell during phagocytosis. C5b binds to C6 and C7, which attach to the plasma membrane of the invading cell. C8 and several C9 molecules bind to the C5b, C6, C7 complex, forming a cylinder-shaped membrane attack complex, or MAC. The MACs form circular holes in the membrane of the invading pathogen, causing water to enter the cell and ions to leave. This results in cytolysis, killing the cell.
He says that
Once
so
the
nicely,
complement cascade is activated, several...
Thank you, sir. You're so helpful. Okay, so there are 3 kinds. A foreign substance binds to an antigen. You have a microbe, which with some other factors, and then you have the lectin pathway, which is lectins bind to carbohydrates. So ultimately, all that leads to, what does that lead to? A MAC attack, where it just pokes big old holes in it, and water comes in and explodes. Hence the name MAC attack. The MAC drills a circular hole in the pathogen. So these are they're named C2, C4. There's 25 of them. They do a lot of different things. Basically, you got an antigen, it presents, and all kinds of cascade of chemical reactions happen, which leads to a MAC attack. Membrane attack complex. Look, this is what it looks like. Actually, little MAC attacks, little holes. Okay, now, real quick inflammation review. Right? Non-specific response to tissue damage. This isn't specific. You're just going to inflame and be like, help! Characterized by redness, heat, swelling, and pain. Yes, to remember, you're going to get all that blood. You're going to vasodilate. You're going to get all the blood. It's going to be oozy. The oozy is going to create an osmotic pathway that's going to cause swelling and pain. The heat is because there's all that blood there, and the redness is because there's blood everywhere. Okay, let's let this guy talk to you about it. Hold on.
Damage to the body's tissues through heat, chemicals, sunburn, cuts, or microbial infections triggers a general, nonspecific defensive response called inflammation. Signs and symptoms of inflammation include redness, pain, heat, swelling, and sometimes loss of function. Inflammation has three main functions: to destroy the agent causing injury, to limit the effects of the agent on the rest of the body, and to repair or replace damaged tissue.
Damaged cells release several chemicals, such as
version.
histamines, prostaglandins, and leukotrienes. Certain components of the complement system can also stimulate the release of
So
histamines.
complement stimulates this.
One function of these chemicals is to cause vasodilation, an increase in the diameter of arteries and arterioles. Vasodilation results in more blood, and therefore more phagocytes, oxygen, and nutrients being delivered to the site of injury. This increased blood flow results in redness, heat, and some of the pain associated with inflammation. The histamines, prostaglandins, and leukotrienes also have a direct effect on the capillaries in the area of the injury. They cause the walls of the capillaries to open and become leakier. This allows more fluid to leave the capillary and enter the tissue spaces,
What
causing
happens when that
swelling
happens?
or edema.
Osmotic pressure.
The increased blood flow delivers phagocytes, such as monocytes and neutrophils, to the scene. The phagocytes stick to the walls of the blood vessels in a process called margination, then squeeze through the gaps between the cells in a process called emigration or diapedesis. Within about an hour of tissue damage, the phagocytes begin to destroy the invading microorganisms by phagocytosis. After engulfing large numbers of microorganisms and damaged tissue, the phagocytes die, forming pus. Other components of the blood lead to the formation.
Just pausing it there to remind you that pus is dead leukocytes. Let's just read my element so you can see it again.
Components of the blood lead to the formation of blood clots, which seal off the site of injury. The final stage of inflammation is tissue repair, the increased delivery of nutrients and oxygen from vasodilation.
Okay, there we go. Do we feel good about that? Okay, let's talk about it again. Here is, it is regulated very often by complement. So you've got a normal permeability of your, here's your cells, here's your vein, and now all of a sudden it's permeable, stuff's coming out. What's that going to cause? That is going to cause osmotic pressure, migration of the phagocytes. It's going to cause, it's dilated so things can get through there. That's going to ultimately cause swelling, heat, all the things are going to come there. And, not to forget, because we have 1 minute left in this video, fever, a body temperature over 37 degrees Celsius or 98.6 Fahrenheit. Because why? Pyrogens. Remember? Pyrogens trigger the hypothalamus to increase the core body temperature. Various types of pyrogens are bacterial toxins, cytoplasmic contents of bacteria released by lysis. So when the bacteria gets lysed, it causes a fever. Antibody-antigen complexes, pyrogens released in phagocytosis. Exact mechanism isn't as known as we'd like you to believe in these classes. Right? So you have a wound or something is happening that gives you, is sending the message to the hypothalamus. The hypothalamus secretes prostaglandins, which resist hypothalamic, which basically resets the thermostat, and that causes things like sweating, vasoconstriction, and the process starts over again. Continue as long as the pyrogens are present. So once the bacteria leaves your body, you don't have the pyrogens anymore, and your fever breaks. That is the process there. Sometimes that's confusing. But basically, your fever leaves when the bacteria leaves, and we know the bacteria has left because there's no more pyrogens present. So this inhibits the growth. Again, remember we talked about the bonus of the fever is that it inhibits the growth of microbes and it enhances your effective of your white blood cells. So there we go.